After turning 60, have you noticed your legs getting weaker? You must press on your thighs to stand up. Carrying groceries feels like climbing stairs, and sometimes simply crossing the living room causes you to lose stability. Many people assume this is just normal aging. But here's the reality. Yes, it's one of the earliest indicators of sarcopenia or age-related muscle decline. Plus, it develops slowly without pain or swelling until you finally need assistance rising from a chair. But here's the positive part. Research shows that only 3 key vitamins can help restore leg power within a few short days. The proper nutrients at the proper time without pricey treatments or intense exercise. These 3 essential vitamins for older adults are discussed in this video, along with how lacking them leads to weak, heavy legs and how to safely and effectively combine them for quick progress. This isn't rumor or health chatter. It's backed by genuine science, clinical evidence, and years of professional knowledge. Stay with me until the finish. I'll also share a vitamin routine that works extremely well, but is ignored by most people. Tell me where you're watching from today. Before we get started, feel free to ask questions and leave your thoughts in the comments. Also, remember to hit the subscribe button and turn on alerts so you won't miss any of Senior Health Tips' best wellness guidance. And I want to know if you're still here with me. If this video connects with you, type 1 in the comments. If not, type 0. After age 60, your body changes slowly yet noticeably. Your bones become more fragile. Your circulation becomes slower. Your muscles, especially those in your legs, begin to weaken. Many don't understand that the first decline typically appears in the legs, making even basic movements like standing or walking difficult. The American Geriatric Society states that people over 60 lose 1 to 3% of their muscle every year, even if they eat normally and feel healthy. This means that within just 5 years, you could lose up to 15% of your leg strength without realizing it. So, what causes this? There are 3 major factors. The first is vitamin shortages. As we grow older, our stomachs make less acid and our intestines become less able to absorb nutrients. This results in low levels of vitamins D, B12, and calcium, all needed for muscle function and nerve communication. The second cause is reduced circulation. Slower blood flow means your legs receive less oxygen and nutrients. That leads to tiredness, heavy legs, and frequent cramps. The third factor is limited physical activity. Seniors who walk less or avoid climbing stairs eventually lose leg muscle mass and strength. And even with regular exercise, muscles cannot fully rebuild without proper nutrition. The good news is that replenishing these 3 missing vitamins may help you regain leg strength in only a few days. Now let's examine each vitamin more closely and see how it supports your legs. Beginning with the one most older adults don't take. Vitamin D3 acts like the master switch that restores leg strength. Vitamin D3 has a far more important role than most think. Did you know that? It behaves like a control switch, activating your entire bone, muscle, and nerve network. And here lies the issue. After turning 60, your body's ability to make this key nutrient drops significantly. Your skin becomes thinner, you get less sunlight. Your liver and kidneys slow down deconversion. Consequently, your body starts to shut down vital functions. Your muscles weaken. Your legs feel heavy. You move more slowly. Worst of all, your balance declines because you are slightly deficient in vitamin D3, which is crucial. Why is vitamin D3 so important? It helps your body use calcium, necessary for strong bones. But that's only step 1. It also ensures proper muscle fiber movement, supports smooth nerve communication, and most importantly, prevents age-related muscle shrinkage. When your D3 is low, your body becomes unsteady and fragile, like an old machine losing parts. How can you notice low vitamin D3, leg weakness, especially when going up steps. Tiredness from standing or walking. Nighttime leg cramps, difficulty turning quickly, and sharp discomfort in hips, knees, or heels. Some may also feel mild anxiety, irritability, or trouble sleeping. These mild issues are often blamed on aging, but they are early signals of vitamin D3 deficiency. What does research show? In the UK, scientists from the University of Birmingham studied adults over 65. Participants increased their leg strength by an average of 19% after just 5 days of 800 IU of vitamin D3. Another study in China found that seniors taking D3 along with minimal exercise saw major improvements in balance and lower body strength within weeks. And older adults with low D3 levels had a 40% higher chance of falling or needing the hospital than those with normal D3, according to data from Harvard's Geriatric Center. The message is undeniable. Vitamin D3 protects your bones, your muscles, and your independence. How does it help? When your D3 level is restored, your body absorbs calcium better, builds new muscle fibers, improves movement speed, reduces hidden inflammation in muscles, and makes moving smoother and less painful. Simply put, vitamin D3 wakes your muscles and joints back up. What dosage is recommended? Specialists advise 800 to 1,000 international units each day for healthy individuals over 60 and 1,500 to 2,000 IU daily for those with a fall history or noticeable signs of frailty. With a doctor's guidance, take vitamin D3 in the morning or early afternoon for maximum absorption, and always with a meal that includes good fats like salmon, eggs, or olive oil. Because D3 can interfere with sleep, it should not be taken late at night. Can food alone provide enough? Sadly, not easily. Let's check the facts. A 100-gram serving of fish supplies about 500 IU. A single egg offers only 40 IU. A glass of fortified milk gives close to 100 IU. To reach 1,000 international units strictly from food, most older adults would struggle to consume fatty fish, eggs, and milk every day. That is why D3 supplements are frequently necessary. Who should take supplements immediately? If you are older than 60, have a plant-forward diet with low dairy or seafood intake, suffer from bone loss or joint aches, feel wobbly, or have had falls before, or rarely get sun exposure, vitamin D3 should be a top focus. A few essential warnings. Even though D3 is usually safe, taking too much for a long time may trigger issues in vulnerable people. Consuming over 4,000 IU a day continuously may cause irregular heartbeat, kidney stones due to excess calcium, headaches, constipation, or nausea. Here's what matters. Use the correct dosage at the correct moment and check your levels consistently. Vitamin D3 is vital for older adults to recover lower body strength. This nutrient reawakens the muscle systems that have slowed across the years. If used properly, improvements may appear within days: lighter walking, sturdier legs, and greater control in every movement. Vitamin B12 restores nerve strength, stability, and leg coordination. Now let's focus on vitamin B12, one of the most important but often ignored nutrients for seniors. You probably know B12 boosts energy and memory. But here's what many people don't realize. Your brain-to-muscle communication, especially in your legs, relies heavily on vitamin B12. It keeps your reflexes sharp, your steps smooth, and your nerves functioning correctly. When B12 levels fall, the messages between your brain and muscles become distorted, and the earliest problems typically appear in your lower limbs. What occurs if B12 is too low? If your B12 levels aren't high enough, you may notice burning, tingling, or numbness in the feet, weakness in the legs when standing or walking, a strange feeling that your legs are not responding, balance issues even on flat surfaces, unsteadiness, or needing support to move. Some individuals also notice brain fog, forgetfulness, changes in mood, or mild sadness. These signs often appear slowly, causing many older adults to think it's normal aging. But in truth, they are hallmark signs of a vitamin B12 deficiency. Why are deficiencies more common in seniors? Two main reasons. First, absorption declines. As we grow older, stomach acid becomes lower, particularly if we use medicines like omeprazole or ranitidine that reduce acid. With low acid, extracting B12 from food becomes tougher. The second cause is dietary choice. Dairy, meat, seafood, and eggs are almost the only significant B12 sources. Eating mostly plants or cutting back on meat increases vulnerability. Even with a healthy diet, your system may absorb too little. This explains why so many people over 60 lack B12. What do researchers agree on? Many studies confirm low B12 harms mobility in older adults. In a UK study at Oxford University, adults 65 plus with deficient B12 walked slower, had worse balance, and were over twice as likely to fall within a year compared to those with normal levels. A controlled trial from the Journal of Gerontology gave older adults different B12 amounts for 8 weeks. Those receiving supplements experienced stronger lower body function, quicker reactions, and less leg numbness or shakiness. B12 supports clear thinking, but also helps the body maintain control and stability. How does B12 work? This vitamin supports the formation of the protective coating surrounding nerves. It improves energy use, helps produce red blood cells, enhances oxygen delivery to muscles, and triggers fast, precise signals from brain to muscle. Therefore, muscles receive the power needed to function. With deficiency, nerves malfunction, muscles misread directions, and legs feel disconnected. Who faces the greatest risk? You're more likely to lack B12 if you are over 60, often take acid-reducing drugs, follow vegetarian-style eating, live with diabetes and take metformin, have digestive disorders such as IBS or gastritis, drink alcohol frequently, or have undergone intestinal or weight loss surgery. If this describes you, a quick blood test is beneficial to check your B12 levels. Warning signs are frequently missed. Some individuals don't feel tingling or numbness at first. Instead, they become clumsier or drop items, suffer mild headaches or persistent fatigue even after sleep. Their feet may occasionally sting or ache. These are signals your body needs help. Acting early speeds recovery. What is the advised B12 amount? For people over 60, 500 to 1,000 mcg of methylcobalamin per day is both safe and effective. Methylcobalamin. Why this one? Because it is the active B12 form, ready for the body to use immediately without conversion. Since conversion ability drops with age, seniors particularly benefit. It comes in chewable tablets, nasal sprays, liquid drops, or sublingual forms that dissolve beneath the tongue. It's best taken in the morning or with midday meals because tea and coffee can reduce uptake. Is food alone enough? Technically possible, yet unrealistic. Here's the B12 in foods. 3 Oz of beef liver, around 70 mcg, 3 Oz of fish, roughly 4.5 mcg, 1 large egg, about 0.5 mcg, 1 cup of milk, only 1 mcg. Therefore, you would need high amounts of fish, liver, or dairy on a daily basis to fulfill needs. For many seniors, supplementation is the most practical choice. Is it harmless? Vitamin B12 dissolves in water. This indicates that any extra amount is removed by your body. Before we begin today, please share where you're watching from. Feel free to drop a comment below and include any concerns you might have. To ensure you don't skip any of Senior Health's top wellness tips, be sure to hit subscribe and enable notifications. It is extremely safe, even when taken in large quantities. There is no established toxic limit of B12 in adults with normal health. Still, speak to your doctor if you deal with ongoing kidney problems or use blood-thinning medications. Otherwise, for the majority of people, B12 tablets are one of the safest and most reliable methods to boost vitality, support nerve strength, and regain balance in the legs. Genuine results, genuine benefits. Many older adults mention feeling steadier while walking, getting sensation back in their feet, rising with more confidence, and even enjoying better sleep once nerve symptoms improve. All thanks to a nutrient many tend to overlook. Besides being a brain nutrient, vitamin B12 is a mobility nutrient. It rebuilds the communication between your brain and body. And when those pathways are clear, your muscles react quicker, your legs feel stronger, and your self-confidence returns. If you have been experiencing odd sensations, weakness in the limbs, or issues with balance, don't dismiss it. Give your nerves what they have been craving by paying attention to your B12. The secret to preventing tiredness and supporting muscle power is vitamin B. You likely already know how vitamin B12 improves nerve-to-leg signaling and how vitamin D3 helps with muscle strength. Thiamine, also known as vitamin B1, is the last missing link in this equation. If D3 switches the lights on and B12 connects the circuits, vitamin B1 delivers the energy or true power. Your muscles need to move. Without it, your muscles cannot perform. Even if your bones are sturdy and your nerves are healthy, your body would lack fuel without B1. Vitamin B1. What does it do and why does it matter? Thiamine, another name for vitamin B1, is vital for energy conversion. This means it helps the body convert food, especially carbs, into ATP, or usable energy. ATP fuels each breath, every muscle action, and all physical movement. Additionally, your legs need a constant amount since they are the body's biggest muscle groups. When your energy production is low, your legs feel heavy, fatigue quickly, and take longer to recover from any effort. Signs of a likely vitamin B1 deficiency. These early warning signs are common in adults over 60. Legs feel weak or overly exhausted, even with little activity. Muscles cramp, especially in the calves or toes. They feel weighed down and dragging while walking. They get short of breath climbing stairs and sometimes feel drained or lightheaded after standing up. Some individuals may also notice brain fog, reduced appetite, and a lack of motivation to move. These are common indicators of slowed energy production in the muscles. B1 usually plays a major role. What causes older adults to lack B1? Several things contribute. The first is reduced absorption. As aging occurs, the digestive system's capability to absorb thiamine declines. Medication use is next. B1 is flushed out in urine by diuretics often prescribed for heart disease or hypertension. Metformin and antibiotics may also reduce B1 levels. Third, alcoholic beverages. Even modest amounts of beer or wine can disrupt B1 uptake in seniors. A poor diet is fourth. Many refined foods lose B1. And if you're consuming fewer whole grains or legumes, your intake may be insufficient. What do researchers say? 2021 Tokyo University findings. Out of 300 older adults in that research, nearly 30% had low B1 status. These participants also moved slower, had weaker legs, and frequently mentioned muscle tiredness. After taking B1 supplements, most experienced noticeable increases in stamina, better walking capability, and improved stair climbing. Journal of Neurological Sciences study. People with chronic leg fatigue took 100 milliliters of thiamine daily. After 1 week, 82% reported better endurance. Less leg pain and heaviness were noted by 68%. No harmful effects were seen. How does B1 support your legs? Vitamin B1 fuels the body's primary energy-generating pathway, the Krebs cycle. This lets muscle cells keep strength and tone throughout the day, produce ATP faster, and recover quicker from movement. Additionally, B1 helps nerve impulses travel efficiently, especially through the peripheral nerves involved in leg and foot control. It's like trying to drive a car with no fuel when B1 is absent. All systems are intact, but nothing moves. How much B1 is required? The advised daily intake is only 1.2 mg for men and 1.1 mg for women. Yet, for seniors with symptoms, much greater amounts are commonly used for therapeutic reasons. Older adults with nerve troubles, fatigue, or weak legs are often recommended by physicians to take 50 to 100 milliliters daily. The positive news: B1 is water-soluble, so any excess is safely eliminated through urine. When is the ideal time to take it? To increase daytime energy, consume B1 in the morning. Take it after eating, ideally a meal that contains protein or healthy fats. Avoid combining with coffee, alcohol, or black tea. These might block absorption. Can you obtain B1 from meals? Yes, but it requires intention. Foods high in B1 include pork and organ meats, beans and lentils, sunflower seeds, and whole grains such as oats or brown rice. However, many older adults don't consume enough of these foods daily, and certain health conditions or medications interfere with absorption. Therefore, if you are unsure or recently noticed severe tiredness, a supplement may be the smarter choice. Who should consider B1 supplementation? If you have type 2 diabetes, test your B1 levels or replenish with a safe daily amount. Drink alcohol frequently, use acid-reducing drugs, diuretics, or metformin, have unexplained weight loss or reduced appetite, or feel exhausted even with light leg activity. Is it safe? Yes. Thiamine is considered one of the safest supplements for seniors and is recognized as safe even in high intake. But if you take medications or have liver or kidney concerns, consult your healthcare provider before starting a high-dose B1. Real improvements. After only 3 to 5 days of thiamine, many seniors report increased energy. The motivation to move and stay active naturally comes back. Walking becomes easier. Going upstairs creates less strain, and the legs feel more free. It's like filling a fuel tank in an engine that has struggled for years. In conclusion, vitamin B may not seem very exciting. It doesn't receive as much focus as D3 or B12, but for older adults dealing with poor energy, muscle fatigue, or leg heaviness, it can be the factor that truly changes everything. Sometimes the most powerful results come from the simplest nutrients. What is the ideal way to combine these 3 vitamins? Now that you understand how vitamin D, vitamin B12, and B1 support your muscles in different ways, the next question is how to blend these nutrients to get the best results. The solution lies in timing and simplicity. First, let's discuss when to take each vitamin. Vitamin D3 is best taken in the morning, right after breakfast, especially if it includes a nutritious high-fat meal like yogurt, eggs, or a little bit of avocado. Why? Since D3 is fat-soluble, it needs fat to be absorbed efficiently. The best time to take vitamin B12 is in the early afternoon or around noon. Taking B12 too late can disturb sleep because it also heightens awareness. Avoid taking it with coffee or tea. These beverages might make absorption more difficult. B1 is your morning fuel. Eat it with your first meal of the day. Ideally, a nutritious breakfast that contains some protein and complete grains. It will boost your energy levels throughout the day and possibly improve your ability to concentrate. This is a simple, everyday example. Breakfast consists of 1 boiled egg, 1 vitamin D, 3 pill, 1 vitamin B, 1 tablet, and a small bowl of Greek yogurt, steamed veggies, grilled salmon or tofu, and 1 vitamin B12 tablet or lozenge make up lunch. Your body gets the correct nutrients in the right amounts at the right times when it is set up this way. Consider consuming a multivitamin. If you are currently taking a multivitamin, carefully read the label. Make sure the formula contains the appropriate amounts of B1, B12, and D3 because many senior formulas underdose these vital elements. Additionally, keep in mind that certain multivitamins contain both fat-soluble and water-soluble vitamins. Consequently, it is still advised to take them with food either in the morning or at lunch, and never without food. Vitamins can help restore health and vigor just like any other tool, but they must be used with caution. When you visit the pharmacy, especially if you're over 60, keep in mind these important safety measures. First, don't increase the dosage on your own. Just because something is natural doesn't mean that more is always better. Taking 2 or 3 times the recommended dosage will not result in faster outcomes. Indeed, it might even be detrimental. Vitamin D3, for example, dissolves in fat. Your calcium levels may rise too high if you take too much, 4, 0 or more IU daily without monitoring. This can lead to nausea, constipation, kidney stones, or even confusion. Second, exercise caution. If you have liver or kidney problems, these organs are responsible for the breakdown and removal of excess vitamins from your body. If they're not working correctly, even typical amounts can build up and cause negative effects. Therefore, if you have been diagnosed with fatty liver, chronic renal illness, or any other significant condition, speak with your doctor before starting any supplements, especially fat-soluble ones like D3. Third, some of the negative effects of vitamins are easy to ignore. For instance, consuming high doses of vitamin B6 for months at a time may cause your hands and feet to become tingly or numb. Unmonitored abuse is especially likely to cause it, though it is rare. Excessive vitamin D3 might cause headaches, muscle cramps, or low appetite long before more serious problems appear. Always be on the lookout for minor mood swings, especially if they occur after taking a new vitamin. Finally, have your blood levels checked. If you are taking D3 or B12 for an extended period of time, it is a good idea to do a simple blood test every 6 to 12 months. This helps ensure that you're taking the right amount of vitamins and that you're not accidentally taking too many or too little. To sum up, taking vitamins can definitely improve your quality of life, but the key is to be informed, prudent, and careful, especially as we get older. When taken as prescribed, these 3 simple nutrients can transform your strength, mobility, and independence. Let's take a moment to review. If your legs have been feeling weak, heavy, or unstable lately, it's not aging. It's not your imagination. And more importantly, it's not permanent. We've seen how vitamin D3 strengthens your bones and muscles. Vitamin B12 restores your energy and stamina, and vitamin B1 enhances your nerves and balance. Together, these 3 essential vitamins form a powerful trio that can help you restore your strength, self-assurance, and mobility. But here's the trick. You have to start. Whether that means checking your blood levels, taking a supplement in the morning, or speaking with your physician, action is always better than waiting. I would be delighted to hear from you right away. Have you used any of these vitamins before? Has your overall level of strength, energy, or balance changed? Please share your story in the comments section. The more we learn from each other, the stronger we become as a team. Thank you for watching. Please let me know where you're coming from today before we begin. Please feel free to ask any questions you may have and leave a comment below.